Time now for Morning Rounds with CBS News contributors Dr. Holly Phillips and Dr. Tara Narula. Good morning to you both.
Good morning.
First up, new questions about the true healing power of medical marijuana. Doctors are allowed to prescribe pot in 23 states and Washington, D.C., but a groundbreaking new study challenges many of the expected health benefits that led to legalization. All right, Holly, what is it telling us, basically?
Right. So this was the largest review to date of the safety and effectiveness of medical marijuana. They looked at 79 different studies that involved about 6,500 or so patients. And what they found was that there was a moderate level of evidence to show it provided relief for a couple of things. Chronic pain, as in cancer, or stiffness that we see in conditions like multiple sclerosis. There was a low level of evidence to show that it provided relief for other things that it's commonly used for: Tourette's syndrome, nausea and vomiting, in chemotherapy, or sleep disorders. I don't personally see this as a tremendous blow to the possibility that medical marijuana will be effective for these things. It just really points out how the paucity of research that we have. We need more research to really be able to make a strong argument.
So many people feel so strongly about this topic and talk about the benefits, but on the scale, do you think that the side effects outweigh the benefits outweigh the side effects?
I do, Anita, and I think there is a lot of stigma and controversy, but I clearly think that there are patients and conditions where the benefits outweigh the side effects or the risks. And I think we've really only begun to see the tip of the iceberg in terms of potential for marijuana. We just haven't studied it enough. But in terms of the side effects, for most of them, the common side effects are mild, and they include things like confusion, dizziness, nausea, dry mouth. And then when you talk about more serious side effects, those do exist too, and the concern in that realm would be things like addiction or addictive potential, cognitive changes, increased anxiety or depression. And then for adolescents who use this, is there potential for long-term damage or changes to the brain because the brain develops till the age of 25.
To add to the confusion here, there's another study that's come out that found edible medical marijuana is often mislabeled. Can this be dangerous, Holly?
It certainly can. So researchers tested 75 different products out there to see if the active ingredients in the products actually matched the amounts that were reflected on the labels of the products. And in only 17% of cases did that happen. So often products were overlabeled or underlabeled. Not only does this raise the risk of the possibility of accidental overdose, but I think it really points to we need to improve manufacturing and quality standards of these medications. That can't happen, though, and as Tara touched on this, that can't happen until we get some changes in how the medicines are qualified right now. Right now, the FDA hasn't approved them broadly on a national level. It's state by state.
Well, now to new findings on Alzheimer's. Researchers at Rush University Medical Center in Chicago found low scores on memory tests and thinking tests may signal the disease years before it can be diagnosed. That's really interesting.
It is. And Alzheimer's is one of these devastating diseases, and we don't have an effective treatment. But the hope is if we can pick it up early enough, maybe we can start early preventive treatments. And so what researchers did is basically look at around 2,000 individuals over the age of 65 and gave them thinking and memory, cognitive tests. And they did that every 3 years, and then they looked and saw how quickly or how early could we pick up on changes. And they were able to see changes in a person's testing ability as far back as 18 years prior to the diagnosis.
Wow.
So, that really does give us hope that if we can catch it 2 decades in advance of the diagnosis, maybe we can offer some help.
Holly, what does this mean for future research into the disease?
Right. Well, very much what Tara was emphasizing. Basically, right now, every 67 seconds, somebody in the U.S. is diagnosed with Alzheimer's. By the year 2050, that'll be 1 in every 33 seconds. We're really seeing exponential rises here. So the idea isn't to wait until people show symptoms or become debilitated. The focus should be on finding those things. If we can find them 20 years earlier, we can maybe prevent them or figure out ways through diet or brain exercises or whatever it might be to stop the onset of Alzheimer's.
Moving on, a new study finds mobile apps that connect people trained in CPR with those in cardiac arrest could save lives. The study found that when the app wasn't used, Only 48% of cardiac arrest victims receive CPR from a bystander. But when it was used, 62% got the potentially life-saving procedure. This seems very important, Tara.
I love this. I mean, we have apps for dating and ordering food and Candy Crush, and here you have something that could potentially save lives.
Right.
So, we know that cardiac arrest in this country, there's about 400,000 on average every year, and the survival is so dim. When you have an out-of-hospital arrest, the survival is less than 8%. But with effective CPR, you can improve your survival by 2 or 3 times. And unfortunately, we know that when somebody arrests outside the hospital, only 32% of the times do they get bystander-associated CPR. People are scared, they're afraid, maybe I'm going to hurt you if I perform CPR, or they panic. So to have something like this where you're activating an app to somebody's phone who actually knows how to do CPR, who's comfortable with it, who can show up and assist, that's huge.
Yeah. The way technology should be.
Exactly.
used.
We're harnessing it for the right reasons. And, there's really a push to make CPR more accessible to the public. Campaigns like hands-only CPR, which tell us that even if you don't do mouth-to-mouth, just hands-only, you can make a huge difference.
Wow.
Push hard, push fast, 100 compressions a minute to the beat of Staying Alive.
Oh, that's
Yes,
good.
by the
We
Bee
all know
Gees.
that.
Yes.
The app can walk you right through that.
All right.
Exactly.
Dr. Holly Phillips, Dr. Tara Narula, thank you both so much.